scarring and fascia. So I am not a scarring expert. I'm just going to give you a bigger perspective when it comes to scarring way past the actual healing period, right? We specialize in virtual fascia treatment for chronic pain conditions, not acute injuries. So this means, let's say Erin had a surgery and an incision here, and there was some scarring that developed here, okay? I am not going to argue that that scar is going to be affecting all sorts of lines of pull. But what I would caution people from doing is taking some tool and just scraping the hell out of the scar tissue. What I would recommend is to free up the structures around it. You are never going to completely be able to get rid of that scar there, but you may be able to correct the adaptation around the scarring. Why I caution and I don't want people scraping the scar. So scar tissue gets a bad rap, but it's practically a miracle. It is a part of our healing process. So if I have an injury and something is fully cut, my body is brilliant. It's going to literally create a different kind of connective tissue and basically build up the scar there. And after that healing period is done, close it up in such an effective way that if I ever trip again or sneeze, I'm not going to rip open there. It's brilliant. It's repaired. So you don't want to go after an area that where the injury has occurred. I recommend to assess the whole system. Sometimes it's the structures around. Sometimes it's actually the structures on the other side that have adapted. But stop just going after those poor scars. Look at the big picture to address an issue that has to do with some scarring.